Hello guys, this is Indian Medico, and in this video we are going to discuss about minimally invasive glaucoma surgery. Minimally invasive glaucoma surgery is abbreviated as MIGS. It is also known as micro-invasive glaucoma surgery. MIGS procedures constitute a group of surgical interventions for glaucoma which share 5 characteristics. That is, they should have a high safety profile, they should cause minimal disruption of normal anatomy, they should have an ab interno approach, they should be efficacious, and there should be ease of use for patients and physicians. Mixed procedures can target Schlemm canal or suprachoroidal space or sub-tenon space. Mixed procedures can be done alone or in combination with cataract surgery. The IOP reduction achieved with mixed procedures is less compared to standard trabeculotomy. So, mixed procedures are useful only in early to moderate glaucoma and not in advanced glaucoma. Coming to the Schlemm canal procedures, first one is eye stent. It is a small transtrabecular titanium stent. This picture shows the first generation of eye stent. The dimensions are 1 mm cross 0.3 mm. It drains aqueous from the anterior chamber into the Schlemm canal. This picture shows the placement of eye stent device. It is placed through a 2.8 mm clear corneal incision with the aid of a gonioscopy lens and is inserted into the infranasal quadrant of angle via an introducer, as you can see in this picture. This picture shows the second generation of eye stent. Immediate blood reflex from Schlemm canal around the stent's snorkel is a positive sign. It can be inserted alone or during phacoemulsification. The next Schlemm canal procedure is hydrous stent. It is a 8 mm nitinol, that is nickel titanium alloy stent. This picture shows the hydrous stent, and this picture shows the placement of hydrous stent. It provides an intracanalicular scaffold after insertion into Schlemm canal via an introducer, and it also dilates the canal. Now let us discuss about trabecular meshwork procedures. First one is trabectome. It is a thermal cautery device which ablates a 2 to 4 plaque cover segment of trabecular meshwork and Schlemm canal under direct visualization with a gonioscopy lens. This picture shows the trabectome system, and this picture shows cauterization using trabectome. The principle is it connects anterior chamber directly with collector channels in Schlemm canal. It can be combined with cataract surgery. The next device is Cahoop dual blade. This is the Cahoop dual blade. It is a microblade and it strips a section of trabecular meshwork and anterior wall of Schlemm canal. This picture shows the intraoperative use of Cahoop dual blade. The principle is similar to trabectome, that is, it connects anterior chamber directly with collector channels in Schlemm canal. The next procedure which we are going to discuss is gonioscopy assisted transluminal trabeculotomy, which is abbreviated as GATT. It is a form of ab interno trabeculotomy. It was proposed by Grover et al. Under direct visualization with a gonioscopy lens, a goniotomy is made in nasal trabecular meshwork, which serves as entry point for the eye tract microcatheter. The microcatheter is 250 microns in diameter and has an illuminated distal tip to allow for visualization during advancement of catheter through the Schlemm canal. This picture shows the procedure of GATT. A modified technique using 40 nylon suture instead of the microcatheter has also been described. Microsurgical forceps are used to advance the microcatheter or suture into the Schlemm canal circumferentially for 360 degrees. Once it has been passed through the entire canal, distal end of the catheter is grasped and proximal end is retracted out of the eye, shearing the trabecular meshwork to create a 360-degree trabeculotomy. This is the procedure of GATT. Indications of GATT include adult or pediatric patients with open angle glaucoma and a clear cornea. It can be done as a standalone procedure or in combination with cataract surgery. Coming to the clinical outcomes following GATT. For primary open angle glaucoma, GATT decreases IOP by 11.1 plus or minus 6.1 mm of mercury. Coming to ab interno canaloplasty, which is abbreviated as ABIC. In this case, microcatheter is threaded for 360 degree around Schlemm canal under gonioscopic view, as you can see in this picture, and viscoelastic is used to mechanically dilate the Schlemm canal. The next one is ab externo canaloplasty. It is not a MIGS procedure per se. In this case, canaloplasty is performed by passing a 9-0 or 10-0 Prolin suture through 360 degree of Schlemm's canal with the aid of a microcatheter and viscoelastic to dilate the canal. It requires the construction of a deep sclerectomy type flap to enable Schlemm's canal to be accessed. Now let us discuss about suprachoroidal procedures, that is SIPAS microstent. It is a supraciliary microstent. This picture shows the SIPAS microstent and this picture shows the SIPAS microstent after placement into the eye. It is implanted through a 1.5 mm clear corneal incision. It increases uveoscleral outflow by draining aqueous from the anterior chamber into the suprachoroidal space. It is inserted over a micro guide wire which creates a small cyclodialysis cleft. It may develop fibrosis around the device leading to failure. The SIPAS microstent has been withdrawn from the market due to excess endothelial decompensation, which has been studied in the COMPASS XT trial. Next, let us discuss about Sub-tenon's microshunt procedures. These include Zen and InFocus systems. These pictures show Zen implant. They connect anterior chamber to subtenon's space, leading to the formation of filtering bleb. They can use microtube technology or gelatin implant. The Zen system uses gelatin implant. While doing subtenon's microshunt procedures, we can inject adjuvant anti-scarring mitomycin C into subconjunctival space to improve the efficacy. No peripheral iridectomy is needed during these procedures. If there is bleb fibrosis, we can do bleb needling revision. The next device is Express Glaucoma Filtration device. It is a small stainless steel mini shunt. It drains aqueous from anterior chamber into the subtenon's space. It can be used in conjunction with standard trabeculotomy surgery. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. Thank you.